Hello, lovely people. So as promised, I have all of my stuff here for sim lab, clinicals, all that jazz, and I'm going to show you everything. I hope that you can hear me okay, because I do have you guys set a little further away from me than I normally do, so you'll be able to actually see everything here. And then if you hear something in the background, that's just baby girl. She's probably going to come in and out, so you're going to hear her puppy dog pounds and all the things, okay? But I'm going to show you everything that I currently have ready for SimLab next week, okay? So let's get started. So we're gonna start with the things that's not the lab kit. I know you guys are excited to see what's in the lab kit. We will do that one last. I'm gonna show you everything else that I purchased or that I plan on using that is not the lab kit, okay? So the first thing that we purchased was, we had to get some patches for our uniform. So these are WGU, the School of Health patches. It does say nursing school, all that. I will, try to put a little picture or something so you guys can see a close-up of what that looks like. Okay, but this is just patches. You have to have one on both shoulders. You are able to sew them on, iron them on, whatever. I don't plan on doing that because I do want to be able to use my scrubs for other things. So I do just have like some little safety pins inside of here, and that is what I'm going to use to put them on. I have heard some people say they did magnets, Velcro, like all kind of things. I'm going to try the safety pins. Now, I did order, they do recommend that you have 2 sets of scrubs at minimum for your clinical, so that way, if one pair is dirty, you have another pair, things like that. So I did purchase 2. Now, I forgot that I had purchased these 2 and I accidentally purchased 2 more. So I have 4 patches. If you are going to wear a jacket, they did say that the jacket has to have the patches on it too. So I guess it's a good thing. So if I decide I want to wear a jacket, I have 2 extra patches. Great. But yeah. Then you have to have your student ID. So this is my WGU student ID that I have. They didn't say what kind of badge reel or anything you had to have. This was just an extra one that I had from last year. I think I bought this one during Nurses Week. It just says, "Oh honey, I'm that nurse." So I thought it was so cute, so I got it for that. And then I just put it in one of these little sleeves because pretty much every badge that I've ever had that was not in a sleeve ended up dying. So I just put it in a sleeve to protect it from my duration during clinicals and nursing school. Next thing is, I'm pretty sure you guys that follow me during my LVN program, you remember this binder. This is the binder that I ended up, instead of having a binder for each class, I ended up just using, I think, 2 binders, and this was one of them. I actually still have quite a bit of the stuff in here. So this is, this is just some of the like notes, study guides, and things that I printed out for different classes that I kept. They're just over here. This is just a little extra sleeve pocket in case I need it. And then, like I said, these were some of the different classes that I did. So that was like maternity, and then all these over here, just different assignment, exams, all that. And then like med-surg here. Like all of these things will end up getting changed out, but this was just already in here. So I decided to leave things in here in case I need it. And I have some notebook paper here in the back. The professor did call me. She did let me know that you will need like a pencil, some kind of scratch paper or something, because you will have to do your dosage calculation by hand, and you would not be able to use a calculator. So she advised some kind of notebook, pens, whatever. So I was like, I already have this. I'll just take this because I never know what all I'm going to need. So I just have this. And then I have some mechanical pencils and highlighters. So don't know if I'll need these things, but I'm bringing them just in case. Then here we have my stethoscopes and my blood pressure cuff, okay? It's pronounced as thermometer. I can't say it to save my life, never could say it, and I ain't gonna butcher it now. But this was just a little cheap one that I purchased on Amazon. Just a little manual blood pressure cuff here, just one size. And it came with this stethoscope. In my opinion, you can't hear very well on the stethoscope. It's very sensitive. It picks up everything is amplified. So if someone next to you is talking, it's going to pick that up super amplified too. So when I practiced on doing the manual blood pressure the other day, I got it, but it was still a little off. So this is my Littman. This is the one that I use at work. But as you guys can see, I blinged it out. And I don't know if it's going to be an issue at clinical. So I'm just going to take both just in case they're like, oh my God, you can't use that one. Oh my God. I'll have this one in case I need it. But I will have a better stethoscope, okay? When I was in nursing school the first time, during a majority of my LVN program, I had a cheapo stethoscope. It was a little better quality than this, I'll be honest. But I did have a cheap stethoscope and I got through just fine. It wasn't until my last semester that I was able to afford a Littman, because Littmans are $100. It wasn't until my last semester that I was able to afford one, and that's when I finally got it. But I had a cheap blood pressure cuff and a cheap stethoscope. It got me through just fine, because for the most part, I think I only had to do the manual blood pressure, at least in my LVN. I really only had to do that first semester. After that, everything was, because you're in clinical, so you use their blood pressure cuffs, so it was electronic. So I got through it just fine with those. So I'll put a picture or video up on the screen of my scrubs. You do need royal blue scrubs. It's about the same color as the shirt that I have on right now. So here are one of the pair of scrubs that I got. So these are the jogger style. I got two different styles. So this is a jogger style. This top and bottom is Cherokee brand. And then as you guys see, I just safety pinned the patches onto the sleeves, because you have to have a patch on both sleeves. And I have my on-cloud shoes on, because it did say you have to have closed-toe black or white shoes. Clogs, Crocs, all of that are not allowed. They have to be closed-toe. So here is one set. Let me show you the other set. All right, and then this is the second pair. These are more of like a, I guess like a bell-bottom kind of style. And then the shirt has like this little design thing. I don't know. I honestly bought both pair because they were cheap. They both are on sale on Uniform Advantage. I'll drop the link down below, and that's where I got these. So the requirements, like I said, they have to be royal blue. You have to have the patches on the shoulders. I haven't put these down good yet, but I'm gonna put them in a second. And they can't be too loose or too tight. My opinion is they look tighter than they are, because like they actually, I have some room in them and I can move like really easy in these with no problem. So I think they'll be okay. But yeah, so these are my scrubs with my shoes. All right, so on to the part that I know you guys are most excited about, seeing what comes in your WGU bag. So it comes with this really nice duffel bag. It's actually, seems like it's a decent quality duffel bag. Pretty nice, has the WGU on it there. This duffel bag and everything that comes in it was, I believe it was $197. It is required for you to get it, to my knowledge. I think I told you guys this in one of my other videos, most of the people are saying they're not using it, and I think that is because after my professor called me the other day, she asked me had I been practicing with the stuff that's in here. And I'm like, I didn't know we were supposed to be practicing yet, but apparently you are. So I'm assuming that this stuff in here is just for you to practice at home. If you are familiar with the skills that you're going to have to do, then, I mean, you probably won't open it at all, but because from what I was told, you use their stuff at SimLab, and then this stuff is at home. This is non-refundable, so once you get it, you're stuck with it, okay? So long story short, for me, I guess I just paid for a $200 WGU bag. Very expensive, whatever. So one of the first things you're going to get is gloves. I believe all of them come with a size medium glove unless you specify otherwise. I did see someone say that you have to purchase your own if you don't wear a medium, but they came with medium, which is fine for me because I wear a medium glove. So cool. And then I threw in here, because all of this stuff just came in a big box in a plastic bag. So in these little pockets, they were empty when they came, but you do get some sterile or surgical gloves here, okay? These are also in a size medium, all of them. So I think if you need another size, again, I don't know if you can ask them for another size or if you would have to purchase these separately, but these are just surgical gloves. They're going to, I'm pretty sure, be for when you're having to don and doff your surgical gloves, for when you're doing your Foley's and all of the different stirrup procedures that we're going to practice doing in the class. So I just threw these in here because I had nowhere else to put them. And then over here, I just printed out, because before you go to Sim Lab, there are two assignments, well, there's more than two, but there are two assignments that you have to do, and they recommended that you print out. This is basically the patient report. They recommended that you print out the patient report for the two assignments that you had to do. So they said print them out and take them to Sim Lab. So I just printed them out and put them in the pocket. I'll actually just put them in here in the binder so I'll know where they are, okay? So now let's open her up. I actually have not fully been through this thing, so we're about to find things together, okay? So first thing, you have a list of everything that is in the actual Sim Lab kit, okay? So I'm gonna tell you all the things that come in here and how many there should be in there. So the first thing that we have here, this is a dual lumen stomach tube, a 14 French, okay? So it's gonna give you that. This is some PPE, a personal protection pack. So some of your PPE looks like a glove, mask are in here. I actually never opened it. Let's open it and see since I'm showing you guys. All right, so it looks like gown, mask, and goggles, and hairnet, okay? So I'll leave this all together because that is one of the skills, like I just said, donning and doffing your PPE. And in here is a bunch of needles and practice saline. None of this stuff, by the way, should you ever inject into yourself or anyone that you are practicing on. All of this is for just practice and probably for dummies. I'm not sure if this is human safe, so do not do any of that when practicing. But yeah, so you have 2 saline flushes here, some needles, a syringe. Let's see what all we got in here. This is a 10 cc syringe. Okay. And then looks like these are, okay, some more syringes. This is for, oh, these are for IV. No. You know, I've noticed a lot of places are going to these type of IV start kits. So these are to start IVs. You got quite a few of those to help you practice starting IVs. These are insulin syringes. More insulin syringes. And then, okay, so some 3 mm syringes with needles attached. More syringes and needles. So basically this whole pack of needle and syringes. So I would be going, I don't want to be too babbling. I don't want this video to be too long, but needles and syringes. Then we have, so this looks like this is probably going to be a wound care kit because we have 2 different types of tape here, plastic tape, paper tape. You have these little wood tips. I call them Q-tips, but they're cotton wood tips. You use these a lot of times to measure depth of the wound. At least that's what we use it for. Okay. And then in here we have a pen light and batteries. Some scissors, which I am so glad because I had some of these scissors from my LVN program and someone at work stole them. So I actually like these scissors, so I'm glad that I have another set. And then in here is just a whole bunch of different gauze, padding, all these different things. This is why I said I think this is probably going to be a wound care kit. Then up here we have a continuous flow solution set. This is something that goes to your IV, okay? And it has different parts for you to like hook piggybacks and all that type of stuff on it. But this is IV tubing. This is for your secondary line. So like if you're gonna hook up a piggyback, also IV tubing. These are some of your vials. I'm pretty sure it's supposed to be medication vials. Let's see. Again, please do not inject any of this stuff into anyone, including yourself. Okay? Alright, so preservative-free demo dose. This is normal saline. This is Practi powder, so this is going to be something when you would have to reconstitute it. That's what that is. What is this? Practice insulin. So more demi-dose of normal saline. I thought it was supposed to have an ampule in here. All right. More practice insulin, and then this is going to be a ampule. This is the one we have to break it. So yeah, so it's the ampule vial where you'll break it, and then you use the filtering needle and blah, 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 okay? So all of this is there. Let me put this away. We can move on to the next thing. So next we have alcohol pads, okay? So these are just your regular alcohol prep pads that you have dang near every hospital. So these will come in here. It's a suction catheter kit with water. Okay, so you have a trach kit for trach care to clean it and care for it. Okay, so this is a wound care tray. So this most likely, let's see what all comes in here. It comes with a drape, medical tape, 2 medical tapes, 1 sodium chloride, an abdominal pad, a reclosable bag, 10 gauze sponges, 1 roll of bandage, and a label. So this is if you're going to dress a wound. Okay. And then this is another dressing change kit. So this is 2 gauze sponges, 3 gauze sponges, okay. Medical tape, a mask, skin protectant, 1 applicator, 1 isopropyl alcohol antiseptic applicator, and a transparent film dressing. So that's what that is. This is a Foley tray, 14 French. And in here it comes with swab sticks, your 14 French catheter, cardboard tray. I'm not sure what that wipe is. A drainage bag, exam gloves, fenestrated drape, labels, lubricating jelly, shrink wrap. What are you using their shrink wrap for? Okay. Specimen container, syringe, a 10 milliliter syringe, towel, and the tray. Okay. And another Foley kit. Looks like with the exact same thing in there. So 2 Foley kits. What is this? Oh, so this is more IV tubing. This is the Y tubing, so you can hook 2 bags to it. This is a IV extension set. This is a irrigation syringe. We use these at work for like catheters to clean their, to flush their bladder out. Not sure what we're going to use this for in sim lab, but that's what they use this for at work. Okay. So this is an IV start kit with all the, like, to put the bandage and stuff over it after you start it. IV start kit. Another IV start kit. And then this is the last thing that's in here. So let's see what's in here. All right, so this last part. Okay. So this is going to be your simulation kit or your practice body parts, okay? That's the best way I can say it that comes in here. All right, so this is for a CVC. Like, I guess we're gonna practice putting in CVCs, which if we are, that's gonna be fun because I've never actually put one in myself. So that would be fun. This is a practice vagina. So I'm pretty sure this is going to be to practice inserting a Foley. So it looks like this is like the stand, I guess, that you're gonna hook this on, because I see this has screws, and then this looks like this has stuff to hook it on here, so you can practice hooking that up. Okay. And then this is a stoma. So I'm pretty sure when we're doing ostomy care. So this is a nose and a mouth. Also has the little attachment there so you can hook it onto the stand. Pretty sure this is going to be like for NG tubes, oral suctioning, all those different things. Practice mouth. So this is, looks like a practice like derma pad or skin pad. So you can practice doing all your different type of injections. So IM, sub-Q, intradermal, all that is going to practice on here. We use this in the LVN program as well. It gets pretty gross after a while. After a while, so make sure you clean it. And then this is a trach tube. So I don't see nowhere we practice the trach. Who knows? Okay. And then I believe this is a part of the trach as well, to practice inserting the trach. We have a practice penis here. Also have the little things to hook on the stand so you can practice with it. Another skin pad, but this one looks like it's going to be for IV insertion practicing. What are you doing, pretty girl? Yeah, so on this one, I don't know if you can see it, but you can kind of see like the little veins, and I'm pretty sure we're gonna hook this to something so you'll get flashback when you actually get in the vein. So you can see the different veins, and you can pick which vein you're gonna start the IV in or draw blood or whatever. But that's what this is. It's the practice IV kit. What's this last piece? I don't know what you are. Let's see. You tripping off all my stuff, pretty girl? Okay. Alright, so this is, looks like it's a wound. So we're gonna practice wound care, I guess, using this little wound. Yeah, so you're gonna dress the wound. Okay? So that is everything that comes in the sim kit or your lab kit. This is everything that I have for my sim lab and clinicals. I will come back with you guys next week to tell you if there is anything that I felt like I didn't have that I needed, or if there's anything that I had that I did not need, okay? But my experience, as I always tell you guys, my experience may not be your experience, so I don't want you to be like, well, this girl on the internet said. Please don't do that. Make sure you get what you need to get, okay? But this is everything that I have. So we are ready, Freddy. And I will update you guys after SimLab. Bye.